A 5-year-old child's become the youngest victim of coronavirus in the UK on a day which saw another large rise in the number of reported deaths. The child, who had an underlying health condition, was among 708 people reported to have died since yesterday. It brings the total number of deaths in hospitals from the disease now to just over 4,300, but there are suggestions that the spread of the infection is slowing. Our Science Correspondent Pallab Ghosh reports.
Brighton Beach would normally be packed on a day like this, but across the country it seems that most people are following the government's instruction to stay at home.
So we haven't got all day to be waiting for your food.
The police have been told to engage with those they suspect of breaching the guidelines, like these people having a barbecue, and advise them to return home. One emotional and exhausted nurse posted a video after a shift in intensive care, explaining why it was so important for people to observe the guidelines.
We're desperately short of staff, and the things are really difficult and we're all really struggling. So I'm just saying to you all to stay in. If you stay in and you don't spread it and you don't catch it, that takes the pressure off of us, because we're all on our knees at the moment, to be fair.
That sentiment was echoed at the Downing Street briefing with the news that COVID-19 had claimed the life of a young child.
Our thoughts today are also with the family of the 5-year-old child with underlying health conditions who's tragically died. So again, you must stay at home to protect the NHS and to save lives.
The latest projections indicate that if people continue to stay at home, the increase in cases could begin to slow down in 7 to 10 days' time and then plateau. And I'd also like to ask Stephen Powis whether we should take any heart whatsoever from the flattening of hospital admissions in some parts of the country.
There is some evidence that the measures that have been put in place, everybody's compliance with them, is reducing transmission, will over a number of days and weeks start to be reflected. The benefit will be reflected first in a reduction in infections, then in a reduction in hospitalisation, and then finally in a reduction in deaths. So yes, there is reason to be hopeful.
Watford General Hospital in Hertfordshire has declared a critical incident and told all patients, apart from women about to give birth, to stay away. The hospital trust says it's because of a technical issue with oxygen equipment. The government continued its testing of NHS staff, but few were turning up today at this temporary centre in Surrey. At the moment, overall, hospitals have the capacity to deal with the expected surge in cases, but that could easily change.
We can keep you alive using the technology and the equipment until your body gets over it, but we can't fix the virus. But the general public, you can fix the virus. You can stay at home, stay indoors, and don't spread it. If nothing else, do not spread it.
The number of deaths are likely to continue to increase over the coming days. Experts say the best way of turning the tide is to stay at home.
Let's pick up on that last point with Pallab now. What should we take away then from these latest death figures?
Well, 708, it's dreadful, and unfortunately that number is going to rise day after day, and it's going to seem like all these restrictions aren't having any effect. But it takes some time for the measures that were introduced to feed it through in terms of controlling the epidemic. And experts believe that it'll be between 7 and 10 days before we start seeing a slowdown in the increase in cases and then a plateauing.
We've also had more information on the number of hospital admissions, so tell us about that.
Well, you can see from the graph that in the Midlands and in Yorkshire and the North East, there's been an increase in cases, but in London, which is said to be 2 weeks ahead of the rest of the country, there's a flattening. Now, we must be careful with these numbers. It's early days and it's not really a trend yet. But what we're hoping for is that plateauing to continue, not just in London, but all across the country. But only if people follow the guidance and stay at home.
Indeed. Pallab, thank you. Now, for the first time since the coronavirus crisis began, Italy has recorded fewer deaths over 24 hours than the UK. Authorities say 681 people have died since yesterday, bringing the total there to more than 15,000. The number of new coronavirus cases there is also stabilising, and fewer people are being admitted to intensive care. Authorities, though, do fear that that could give people a false sense of security, with many now asking the government to relax the lockdown restrictions. From Rome, Mackenzie has sent this report.
A slice of normal, a local market reopening for the first weekend since Italy's lockdown began, albeit with some caveats.
Serviamo una persona alla volta, comunque vedendo che tutti mantengono la distanza. Abbiamo messo anche un ragazzo a fare il servizio d'ordine.
Do you think this is safe?
Così noi cerchiamo sempre di fare attenzione a tutto, ce la mettiamo tutta.
There are very few people, everything is under control, so it's okay.
What difference does it make having the market open again?
It seems like, normal.
But things are not normal. Italy may have reached the peak of its epidemic, with fewer deaths here in the last day than in the UK. But the country is still in strict lockdown. As the infections plateau and even start to decrease, and the weather keeps improving, it's going to be a real challenge for authorities to convince people to stay indoors and play the long game. Because the lockdown is working, they say. Just look at the hospitals, where the number of people in intensive care has fallen for the first time since this crisis began.
The situation, for the first time after weeks, is not worsening anymore. We are still working 12 or 15 hours per day following them. They're serious, they're critically ill, but we can now cope with it. It is a relief.
From a rooftop in Rome, this serenade has become a nightly affair. People leave their homes to soak it in just for a few minutes, while police look the other way. The sound of hope returning. Mackenzie, BBC News, Rome.
Well, here, Buckingham Palace has given more details of tomorrow night's special broadcast by the Queen about the coronavirus emergency. Our royal correspondent Nicholas Witchell is here. What do we understand she might say, Nick?
Let me just put this broadcast in context, first of all. It's the first time in the Queen's reign that she will have broadcast to the country at a time when the entire country is facing a serious threat. Now, it's not wartime, but everyone is facing the same peril. Everyone has a part to play. We're told that it's a deeply personal message from the Queen. She will talk about a challenging time which has already brought grief, financial difficulties, and enormous changes for everyone. She will, of course, thank those on the front line in the NHS, in care homes, in essential services. She will recognise the pain that is already being felt by many families, and she'll thank everyone for playing their part, for following the government guidelines to protect the vulnerable. And then, in what I think is a real echo of wartime spirit almost, and of shared national purpose, she will say this: I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say that the Britons of this generation were as strong as any, that the attributes of self-discipline, of quiet, good-humoured resolve, and of fellow feeling still characterise this country. So, a situation without precedent in her reign, and a broadcast intended to reassure and really draw the nation together. It will be transmitted, of course, at 8 o'clock tomorrow night.
OK, Nick, thank you.